Okay, Manitoba, you wanted to know response to some questions about yourself being in the dental field and how cerebral palsy affects sitting in the dental chair and dental hygiene and even dexterity. Well, if the person is spastic, they can't even slide out of the dental chair as they push forward, and the chair, as the chair is tilted back, they gradually start to slide out of it. And so if their chair has a tilt recline on it, as a lot of them do, a lot of the dentists now, like mine, prefer to treat the patient while they're in the chair. So you're going to be tilted back in your chair, treat the cavities, do whatever they're doing in the chair, so the patient is actually in their own wheelchair, strapped in or whatever. How CP affects dental hygiene. A lot of individuals with cerebral palsy are quote-unquote mouth breathers, like myself, which would affect periodontal disease and gum disease, because you breathe through your mouth, so you have to pay particular attention to your gums and mouth care. Dexterity. I have trouble brushing one particular side of my mouth because my hand only reaches one side very well, so I get my caregiver to help me. And so floss handles, which you are familiar with. A lot of clients with CP should be encouraged, because floss handles are difficult to use with dexterity, even though you can use them with the two prongs and put the floss in between. To use the battery operated one, such as the one offered by Crest here in Canada a few years ago. I don't know if it's still available, but I picked mine up for like $12 at London Drugs, and it just takes standard batteries, and so they can do their own teeth to encourage independence. And so we've covered gingivitis, we've covered mouth breathing. Teeth grinding. Some clients with CP, either particularly those with some with low functioning grinding teeth, so either at night, not only those with low functioning, because I grind anyway, so I am supposed to wear a mouth guard. I'm not so good at wearing it because I have a gag reflex, so I always feel when I'm gonna choke on my mouth guard, but I do have one, and it does help. But there's issues with grinding and clenching because of the spasticity. There's issues with mouth breathing. There's issues with sliding out of the dental chair, which you can prevent if you have a tilt recline chair. And some cerebral palsies have teeth that come in crooked because of prematurity and stuff. So some CPs, I've been fortunate to have teeth that are all straight and stuff like that. But some CPs have really bad crooked teeth because of prematurity and stuff like that. So I hope that answers your questions. If you got any more, feel free to email them to me again. And I will try to answer them. I really like corresponding with you. You're so far the person that's corresponding with me. So that's great. Talk to you soon.